trying to look back and see what one considers one's greatest achievement, I suppose I'd have to put first the essential capture of my wife, if one looks at it that way, because it was rather an unexpected and unusual situation. A very close friend of mine from medical school days, who was also in London at the time, phoned me one weekend and said, "I've got an emergency problem, can you help? I've asked a very interesting young Australian girl that I've just met to come for a picnic on Sunday, but my vintage Riley car sprung a leak in the radiator. Would you be prepared to chauffeur us?" So being a good Samaritan, I said, "Fine, absolutely." And so we went out for a very nice picnic. And one of the most striking things, apart from the vivacity of this young ex-Hungarian Australian lady, was the most incredible salami sandwiches that she gave us, Hungarian salami, and it seemed to have gone straight from my stomach right through to my heart, because 10 days later we actually announced our engagement, and then we got married about 2 months after that, and we had this subsequent 55 years together. So I think that would certainly be an achievement, and also, of course, it steered me in many ways directly into my career. If you want one or two others, I think that in a sense was groping in various aspects of medical science and medical work, and always doing things that I was particularly interested in doing at the time, but eventually channeling back into paediatrics, and in essence getting a lift up from what was a senior house officer post in paediatrics at Queen Mary's Hospital for Children to a lectureship in Sheffield, with total responsibility for running a ward and setting up my own sort of clinics and research interests in 1960. And then, of course, I gradually concentrated on a career in pediatrics, but also specifically in relation to neurology, and in particular in relation to muscle disease. And I think the sort of combined experience of working in a lab and doing basic research in human and animal muscle, and then working in a clinic and having direct contact with the patients, which I always enjoyed, really gave me a very much broader perspective, in a sense, of the disease from both research and clinical point of view. And in fact, it was my policy for many years, particularly over the period we were at the Hammersmith, where we also had a very active research team, to tell the people from the lab that they were always welcome to come to the clinic, come and sit in with us and see the patients. And when they thought it was perhaps embarrassing for the patients, I told them not to worry, because I would always introduce them, and I'd always ask the parents' permission if it was okay for our research team to also come and join us. And there was never an occasion that the parents didn't welcome them in a sense. So this integration, I think, of the basic laboratory with the clinical, and also the integration of the clinical with caring for the family, because this was a pediatric approach. The neurologists were saying in those days that there's nothing much one can do, make the child comfortable, and then they discharge them from any follow-up care, whereas my approach was the opposite. There's always something you can do to help a family, however serious or however severe a problem is, and it's more important to maintain contact and to see these children on a regular basis than to just dismiss them. And of course that's the way I was taught actually from the patients about many of the diseases. So it was also a educational process for me.